In India, we have 5-year programs, and every 5 years we have new strategies for public health programs, and this burden is projected to double by the year 2020. So Emerald project provides a unique opportunity to keep mental health on the forefront in terms of priority, how to develop the adequate health system processes. In India, for this project, the Public Health Foundation of India is a lead organization, and in this project we are mainly concerned about adequate, fair and sustainable resourcing for the mental health system, which is A, health system inputs. Then we speak about the health system processes, how to develop the adequate health system processes for strengthening the mental health system in India. And then we speak about integrating the mental health services with the existing primary healthcare services and health systems in India, which is 3 health system outputs. So mental health system is not really priority in the overall public health system in India, because I come from public health research background, and I can say in India, although the maternal and child health is a priority in terms of Millennium Development Goal, and although in India tuberculosis or disorders, communicable disorders like HIV are priority, mental health in terms of economic sustainability or budgeting or other priorities is definitely not given a priority. But Emerald project is definitely doing its share in Indian public health system to keep mental health on the forefront in terms of priority, because in terms of global burden of disorders, mental health constitutes a fairly a great share of burden for disorders in India. For example, in India, approximately 9% of the all disorders is shared by mental illness, and this burden is projected to double by the year 2020. So we are looking at about almost 1/5 of the disorders owing to the mental health disorders in India. So Emerald project in India is really trying to look at these gaps in the treatment, because in India only 10% of people with mental illness received any kind of care. So Emerald project is not only looking at the service delivery component, but is also looking at the strengthening in the policy making component, planning component, service delivery, service development component, monitoring and evaluation of services, mental health research, and very important and very neglected component of involvement of people with mental illness and their caregivers to strengthen the mental health system. In terms of impact, when we think about the impact, the project or any intervention takes a longer duration than 3 to 5 years. In India, we have 5-year programs, and every 5 years we have new strategies for public health programs and public health system. But when we speak about mental health system, since it is not a priority, there not has been a sustainable project or an intervention for India. We had about 3 decades of national mental health program, but there was not really revisions and the overall projection or covering of the whole nation. So Emerald project provides a unique opportunity to have a geographical as well as system level scale up of a program. So Emerald project not only works in an implementation site in Madhya Pradesh, which is an implementation site for Emerald, but Emerald also works at the national level with the other components of the mental health system, be it policy making, be it planning, or be it monitoring and evaluation or research. So Emerald really works at the national level to strengthen the mental health system in all the building blocks. So Emerald has a very good impact going above the geographics of the project.